First, though, I want to talk with a great friend of mine who I've had the pleasure of working with for years, and a incredibly important truth teller whose story and information and advocacy and activism is going to be even more important than ever right now, as Donald and his minions in the Capitol come for our health care. Joining me on the line is Wendell Potter. Wendell, thank you so much for joining us on Skype. Is Wendell Potter. Wendell, thanks so much for joining us.
Thank you, Alex. Glad to be a part of the show. Good to talk to you too, especially.
So, Wendell, why don't you tell us a little bit about your background and why I introduced you, as your story and the information you bring to this is so important now. Wendell and I met each other when we were pushing for a better version of Obamacare than what we actually ended up with. But in that fight, I learned your story, Wendell. Can you just share a little bit of that so that everybody knows?
Well, sure. Thanks, Alex. As you know, I spent 20 years working inside the health insurance industry at senior levels. I was working at Cigna Corporation, one of the biggest for-profit insurers, when I decided to quit after a crisis of conscience in 2008. And that crisis of conscience came as a result of me coming to realize that what I was doing for a living was making it possible for people, or making it necessary for people, to get care in barns and animal stalls. And I'll explain that. I went back home to Tennessee to visit folks back in a few months before I left my job, and I picked up the newspaper, saw something about a healthcare fair, or expedition as they called it, a few miles from where I grew up. I went there out of curiosity, and I saw thousands of people at this county fairgrounds lined up, standing in the rain. And I saw that these long lines that stretched out of view, they were leading into barns and animal stalls at that county fairground. That was an epiphany for me. And soon after that, I made a decision, a pledge that day, that I'd find some other way to earn a living. And I did, or at least I left my job without a plan, without another job lined up. And I decided to try to help advocates to push for healthcare reform and to help members of Congress understand how insurance companies really work. So I wound up testifying before Congress many, many times during the healthcare reform debate.
So, Wendell, let's go through a little bit of what we're hearing from Donald and from folks on the Hill, and they're not even similar. So we have to actually treat them separately. And you know, the biggest question for policy advocates and people who pay attention is who is actually in charge of the agenda right now. And, you know, like, just as an example, Donald keeps saying that, you know, he's not going to do anything with Medicare. And his people have consistently actually said, Sean Spicer said it, Reince said it. His direct minions said they're not going to do anything with Medicare and Medicaid. But you go to the Hill, and Medicare and Medicaid are right in the middle of everything, especially Medicaid. I mean, full destruction of Medicaid. Paul Ryan, you know, the evil Eddie Munster looking guy, goes on CNN and he details, you know, bullet point by bullet point, his plan to destroy Medicare. So I want to kind of go through the two different ones separately, because they're obviously not talking about the same thing. But even in his, you know, like, Trump is not bound by facts or reality or anything, right? He just says things. And then he maybe tweets out things and goes with it. But even in his, even with unbounded by fact, if you actually know how healthcare works, his promises don't make any more sense than anything else, right? I mean, like, he's saying what he's saying he's going to do is not possible. Can you kind of explain a little bit about why what Donald Trump is saying is not possible?
Yeah, exactly. And it's clear that he doesn't have any knowledge at all, any understanding of how healthcare is delivered and financed in this country. On the Hill, they do. And as you said, the Republicans are, for many years, have been trying to dismantle Medicare and Medicaid and to privatize the whole healthcare system as much as they can. What Trump is saying, in fact, he told the Washington Post in an interview over the weekend that he is going to ensure that everybody has in his words, beautiful coverage, where we'll all be beautifully covered, which is, sheer nonsense from what he's talking about. Although he has said, as you may remember, back in 2015, during one of the GOP primary debates, he expressed some admiration for the healthcare systems in Canada and Scotland, which are single-payer systems, right, and said that we should have something like theirs. But then he obviously has backed off from that.
But if that would be the only way, actually. So like what he's saying of, oh, I'm going to give everyone beautiful coverage and everyone will pay less money and everyone's going to be covered and there's not going to be pre-existing conditions or lifetime limits or a mandate to buy health insurance or, right? And he lists all these things and you're like, that's literally all impossible. There's only one thing that could do that, which is expanded Medicare to cover everyone. But there's no way that his minions on the Hill are going to do that. In fact, they're going the exact opposite direction.
Yeah, it's dissonance. There's no doubt about it. And you're exactly right. The folks on the Hill, the Republicans on the Hill, would never consider expanding Medicare for all, which makes a lot of sense, of course, but it doesn't fit into their worldview of the so-called free market. And they don't really understand that either. At least if they do understand it, they're very callous, because there is no way, as you noted, in the world that you can get everybody covered with quality, with decent coverage, and that people can have access to the care that they need without doing exactly that. The insurance companies, the private insurance companies, would do that only on if only one thing happened, and that is to give them the keys to the Treasury. If they did that, if they could get all the money that they wanted to cover everybody, then sure, they'd do it.
No, they wouldn't. I would say they still wouldn't, Wendell. They would still actually, they'd take, or let me put it this way. The insurance companies said, oh, well, you should let us just have these mergers after mergers. There used to be dozens of them. And they're like, oh, no, but if you let us just merge and merge and merge and have these massive businesses, we'll cover more people and we'll deliver savings to the people. So then there's 5, and yet, nope, no savings to the people, even under the slightly heightened regulatory framework of Obamacare. They still figured out ways to rip people off, and they're continuing to consolidate, right? So we go from the big 5 and now we're going to look at the big 3. I think I think the point is we're going to get to single payer. It's just whether is it going to be single payer corporate delivered health care, which means no one's going to get health care. If you're sick, you're on your own, and a handful of plutocrats are going to get extra golden yachts. Or is it going to be an improved and expanded Medicare for everybody, where we actually push out the intermediaries, which is a really unfair, that's not true. Intermediaries, they don't deliver anything. They just extract things of the insurance company and especially of the pharmaceutical industry.
You're right. And this talk about what the folks on the Hill and even Trump is saying, that we need to have more competition in the insurance industry. Well, first of all, that's not going to happen. Insurers talk a good game. They talk about choice and competition, which is one of the buzz terms that they've used forever, and while at the same time doing exactly as you described, consolidate to the point that we just now have a very few big, gigantic health insurance corporations, most of which are now publicly traded, and they answer to Wall Street, not to their enrollees.
They have one master, and it's Wall Street.
That's exactly right. There is no way, you're right there too, that they would care anything about making sure that people get the care that they need. In fact, the way they make money is to avoid paying claims, to avoid having people get the care that they need. They always, when they price their premiums, they also, this is an example of just a reason why they can't control healthcare costs. They can't, but they all estimate what they think the rise in healthcare costs are going to be during the next year. That's how they figure out their premiums. So it's all about the money. They always factor in how much they can do, how much profit they think they can make to reward their shareholders.
So Wendell, we're gonna just have a longer segment here because I love speaking with you about this, and I think it's important that people understand this right now, especially. let's go to, so we did a little bit of what Trump's talking about, which is just, it's basically fantasy, right? Like that's where Donald is.
It's
But
magical.
where the Hill is where the Republicans on the Hill are, where they've been forever, right? Like you don't need to guess what's coming because we've seen it. They literally tried 60 times. They've gone through the budget reconciliation process twice. They sent 2 budget reconciliations up to Obama, who vetoed them, right? So we know what's coming. And let's go through what the plan actually is. It's to throw 23 million at least people off of their health care coverage, around 30 million people losing health care coverage. It is to remove all of the restrictions that were placed on the insurance industry that were little great things that came out of the ACA, like pre-existing conditions, like lifetime spending caps. All of the ways that they actually made money by taking premiums and denying care, because that's the insurance business model for health insurance. Take your money, and then when you need the care that you're paying for, deny you that.
You're exactly right. That's a business model, and of course, that's not sustainable. You cannot bring people into coverage when you're doing that. When you're doing the best you can to exclude people who need care from getting the coverage they needed. Before the Affordable Care Act, they were able to blackball people who had been sick in the past. In other words, declare them, and this is a term that they often use, uninsurable. They would declare certain people uninsurable. And once one insurance company has turned you down, your chances of getting coverage from anybody else are slim to none. That's why, Alex.
So in our final minute here, Wendell, tell us, like, where can people go to find more information about you and the work that you're doing right now and the truth telling that you're doing for the fight back?
Go to wendellpotter.com. It's where all my writings appear. My latest book is Nation on the Take, How Big Money Corrupts Our Democracy and What We Can Do About It. And my newest venture is tarbell.org, which is a new online journalism site. I encourage people to go there because that's going to be a real truth-telling media organization when we get ramped up.
Wendell Potter, thank you so much for joining us on the Thom Hartmann Program. I say it often, for the political revolution to happen so that the government works for the people again, so that we can keep the greedy liars on Wall Street and the people who work for them in the insurance and the pharmaceutical industries in check. The political revolution needs to happen, but to get there, we need a media revolution, and tarbell.org is part of that media revolution. Wendell Potter, an incredibly important truth teller. You're listening to the Thom Hartmann Program. I'm Alex Lawson, filling in for Thom, and we will be right back after this.